Hello, and welcome to nursing care of clients with cardiac disorders. In particular, we're going to be talking about inflammatory cardiac disorders, starting with rheumatic heart disease, and then we'll wind up talking about infective endocarditis. Okay, so let's go. Rheumatic fever is an inflammatory condition involving connective tissue in the body. Its most severe complication is rheumatic heart disease. This condition may permanently damage the heart valves and affect the flow of blood to and from the heart. As you can see in this picture, the base of a valve, the annular ring, and the destruction of the leaflets by the pathogen. Symptoms of valve damage often don't appear for the client for 10 to 30 years after the initial episode of rheumatic fever. Rheumatic fever is a systemic inflammatory disease that is caused by an abnormal immune response to pharyngeal infection by group A beta hemolytic streptococci. It is thought that antigens from an abnormal immune response bind to cells in the heart, the muscles, the brain, and synovial joints, which causes inflammation. Carditis may develop, and damage to valvular structures may occur. Valvular deformity results in stenosis or regurgitation of the heart valves. Signs and symptoms include chest pain, a friction rub, heart murmur, and possibly a migratory polyarthritis. And then some other less common signs and symptoms are shown here in the list. Rheumatic fever is a complication of group A Streptococcus pharyngitis, more commonly known as strep throat. The vast majority of people with strep throat do not develop rheumatic fever. However, in some people infected with group A strep, the body's immune system not only fights the bacteria, but also attacks its own tissue, especially the heart tissue. Now, risk factors for streptococcal infections of the pharynx include environmental and economic factors, such as crowded living conditions, malnutrition, immunodeficiency, and poor access to health care. There may also be a genetic factor in susceptibility to rheumatic fever. Prompt identification and treatment of streptococcal throat infections helps decrease the spread of the pathogen and the risk of rheumatic fever. The importance of finishing the complete course of antibiotics should be emphasized to the patient. In this slide, we see the white drainage patches that are very characteristic of strep throat. We see those white patches on the tonsils in the back of the pharynx. So measures to prevent rheumatic fever include emphasizing early and effective treatment of strep throat, and stress the importance of completing the full course of antibiotics. If it says 10 days, then it should be taken for 10 days. Sometimes people who have valvular heart disease will also be instructed to take antibiotics prophylactically before they have any type of invasive procedure. Well, as soon as a diagnosis of strep throat is made, antibiotic therapy is initiated. Penicillin is the drug of choice. However, if a patient is allergic to penicillin, the alternate drugs of choice would be erythromycin or clindamycin. Okay. The goals of treatment are to kill the strep bacteria, treat the inflammation caused by the rheumatic fever, and prevent future cases of rheumatic fever. Treatment may also include aspirin and other non-steroidal anti-inflammatory drugs or NSAIDs. They may be helpful with any joint pain and swelling that occurs. Corticosteroids may be used if NSAIDs are not effective. Sometimes rest is also prescribed, especially if the inflammation is severe. The doctor may prescribe bed rest or severe restriction of physical activity for a period of time. Prevention involves promptly treating strep throat with antibiotics, and that can prevent rheumatic fever. So if you or your child has a sore throat and a fever that lasts more than 24 hours, it is important to contact your primary healthcare provider. And because of the sequela, we mentioned the sequela of strep infections, of group A beta hemolytic strep infections have two sequela that you need to be aware of for your nursing studies. The first one we are talking about here, which is your cardiac valvular disorders. Okay, nobody wants to have their cardiac valves destroyed simply because they had a complication of strep throat. The other one that you should be aware of is post-streptococcal acute glomerular nephritis. Okay, hopefully you've been exposed to that in a previous course, but understand that there are two serious sequelae that can come after having a strep infection, including valvular heart disorders and acute glomerular nephritis. Here I want to talk about the misuse and overusage of antibiotics because it is creating a major downfall in our society. Many times people stop taking the antibiotics when they begin to feel better, despite the instructions that are on the bottle. And this creates a huge issue for scientists who are forced to create a stronger and stronger prescription or antibiotic. The bacteria which are causing the illness will mutate to accommodate the antibiotic if the prescription is not used to its full extent. So when clients misuse antibiotics, they're putting the world at greater risk for infection. The bacteria simply get stronger and more resistant to the antibiotics that we have. The select few bacteria which survive end up reproducing and creating more of their own resistant kind. This is why it's always important to take the full complement of antibiotics and to not shorten that course simply because they are feeling better. So having learned that heart disease can result, let's look at two patients here on this slide. On the left, we have a famous personality from long ago named Patsy Cline. She was a country music singer with apparently a very fantastic voice. She died tragically in 1963. And I know that's a long time ago, but I find her story very interesting. She also had a brush with death when she was 13 years old that resulted, it was a serious case of rheumatic fever. And looking at her picture here, before her death, we see from the plane accident, we see that demonstrated here in her posturing and her position that Patsy Cline did have serious cardiac heart disease as a result of her rheumatic fever. She said about the illness, "The fever affected my throat, and when I recovered, I had this booming voice." So it did affect the quality of her voice, but and propelled her into stardom, yet it did leave her with a sequela of valvular heart disease. And I want you to make that connection between valvular heart disease and heart failure, okay, and cardiomyopathies. So you see that in her position. She's in an orthopnic position because that helps her to breathe better. That is a clear sign that she indeed has heart failure. And it all stems from her original throat infection. All right, and then on the right, we see a young patient. She's only 11 years old. And she also had valvular heart disease as a result of rheumatic fever. And in her case, she had to have a valve replacement. And she got a mechanical valve. And then she routinely reports to her cardiologist, her pediatric cardiologist, for ultrasounds or echocardiograms to evaluate her heart muscle and the functioning of her new valve. So remember, we said echocardiograms can be used to assess structure and function of the heart, and that is why this young patient has to routinely go in and have an echocardiogram done. Okay, of course, echoes are not painful, but it's just to help you to remember that there are serious sequelae as a result of strep throat infections. And in this case, which I think is kind of interesting to note, that when patients have a mechanical valve and they are laying still and it's quiet in the room, they can actually hear their own heart valve opening and closing, like a click, click, click. And so all of you as well, when you're assessing patients, may actually come across a situation where you can hear the clicking of a mechanical heart valve. Now we're going forward and talking about another inflammatory cardiac disorder. This one is called infective endocarditis. Development of endocarditis requires entry of pathogens into the bloodstream. Vegetations of pathogens form on the cardiac structures, most commonly the valve leaflets. As these vegetations grow, they interfere with the normal movement of blood through the heart. Complicating the matter is that the vegetations may also fracture or become an embolus. A fragment is torn off by the blood stream rushing by, and it embolizes that fragment of vegetation. Okay, so then it travels again as an embolus. And of course, it can end up anywhere in the body, depending on which valves are affected or where the location of that clump is. Endocarditis is inflammation of the endocardium. It is generally infectious in nature and results in the colonization of the cardiac structures by a pathogen. It's important to remember that endocarditis can be prevented in clients at risk by administering antibiotics prior to certain procedures. Okay. Also, I'll mention here that patients who have prosthetic valves can develop prosthetic valve endocarditis. And this occurs in clients who have undergone valve replacement. So prosthetic valve endocarditis may develop early in the post-operative course due to a contamination of the prosthetic valve during surgery or a perioperative bacteremia, and usually has a rapid course with high mortality. As we just mentioned, valve prosthesis is a risk factor for infective endocarditis. But there are many risk factors, and they are listed here. One of the very characteristic risk factors we see frequently is intravenous drug use. Now, perhaps because I go to Tampa General Hospital, and they have a large indigenous population, I should say a large population of homeless people is what I'm trying to say. And that because of that, we get a large population of IV drug users who come into and use that hospital. And this is frequently the case. That is the way in which the pathogens make entry into the bloodstream. Well, these pathogens set up shop usually on the valve leaflets, although it can be anywhere on the endothelial surface, and they set up shop on the leaflets, and that destroys the cardiac valves. Okay, so they're frequently in the hospital having cardiac valve replacements. Okay, unfortunately, this can become a recurrent issue because when they leave, they continue to use IV drugs. And then we have, again, issues with destruction of the heart and the valves. And there have been times when these patients have been in even 2 or 3 times with open heart surgery to replace these valves. Also, another one that we see is dental procedures and poor dental health. Now remember that our gums and oral membranes are highly vascular, and we have proof of that, right, when we floss our teeth. Sometimes even flossing causes them to bleed when you have good dental health. So poor dental health and dental procedures is another way in which pathogens can get into the bloodstream, and they want to set up shop on the leaflets of the valve, causing their destruction and endocarditis. Recent heart surgery, again, so these are other ways, invasive catheters that will increase a patient's risk of developing infective endocarditis. Even congenital heart defects can increase the risk. Okay, so these are all things to think about. Education of susceptible people is a key part of prevention. Clients with pre-existing heart valve damage or heart valve replacement may require prophylactic antibiotic administration prior to any scheduled or future invasive procedures, including routine dental work. Classifications of endocarditis are acute infectious endocarditis and subacute infective endocarditis. Acute IE has an abrupt onset and a rapidly progressive course, compared to subacute infective endocarditis, which has a more gradual onset. Signs and symptoms can be nonspecific and flu-like, meaning that the patient may have chills, fever, a general malaise, fatigue, cough, joint pain. There is also the presence of a heart murmur. Anorexia and abdominal pain may develop with splenomegaly. Okay, but in this picture, this diagram, we see that the vegetations or clumps of material that are growing on the valve leaflets as well as the endocardium. Okay, in this picture, it's the aortic valve, but it's not particular to any one valve. It can affect any of these valves in the heart. And the vegetations really are clumps of the bacteria and small blood clots, as well as other debris. And they can grow quite long and actually float out like a flag into the bloodstream. and every time the heart valve opens and closes, we see this long vegetation, like blowing in the wind type of action going on. And of course, we said the danger with that would be if it fragments and becomes an embolus. In this particular picture, if one of those clumps would break off, it would then go through the aorta, and the first and some of those upper arteries, the internal carotids, and may go up to the brain. Okay, so the embolus could travel up through that way up to the brain and cause a stroke. So it just depends on the location of the vegetation as to what type of and if an embolus occurs, where it is directed in the body. Certainly if it happened on the right side of the heart, then it could go to the lungs and become a pulmonary embolus. Nursing questions do bring up this topic quite frequently. So we'll want to know these. These are called the peripheral manifestations of infective endocarditis. Okay, so these are peripheral signs and symptoms. And let's begin by talking about the splinter hemorrhages that you can see in the fingernails. Okay, so these occur because of microemboli or circulating immune complexes, and that can be a sign of IE. Then we have the Roth spots on the retina, and you can see them by the blue arrow because it has a white center to it. Okay, you would have to look at that through an ophthalmoscope to see the Roth spots back there. And then you have the ossular nodes on the finger and toe pads. Okay, and below that you have your Janeway lesions of the palms and the soles of the feet. Please make sure you understand the distinction. Go read your textbook or look it up online, the distinction between ossular nodes and Janeway lesions. Frequently, that's a point of confusion for students on nursing questions. Common complications of endocarditis are embolization of vegetation fragments. Also, heart failure is a big complication. Without treatment, endocarditis is almost universally fatal. Antibiotic therapy is generally effective in treating the disease. However, understand that the heart valves do not have blood vessels. So oral prescription of antibiotics is never going to eliminate that infection, okay, or those pathogens. So instead, it requires intravenous antibiotics, and for a prolonged course, like sometimes 4 to 6 weeks, 6 to 8 weeks. We're talking about a long course of intravenous antibiotics. Sometimes these patients remain in the hospital. Other times they can go home and have a PICC line, for example. And if they have a PICC line placed, then a home health nurse can visit their house and administer the IV antibiotics. Okay. But that's not always possible with our patients, especially if IV drug use is the reason why they have infective endocarditis. We certainly can't send somebody home who has an IV drug problem with a PICC line. Okay, so there are all kinds of ethical concerns when it comes to the treatment of these patients sometimes. Another thing that makes it difficult for those antibiotics to work on the vegetation lesions on the heart valves is the fact that fibrin strands cover the lesions and it protects them from antibiotics. So it's very stubborn to get rid of that infection. Nursing diagnoses include risk for imbalanced body temperature, risk for ineffective tissue perfusion. Okay, that's one that we are really stressing, as you can see in our module on perfusion, and also ineffective health maintenance, especially with IV drug users, and making sure that they get their prolonged course of antibiotics. This slide presents a mnemonic that can be used to help remember the signs and symptoms of infective endocarditis. The mnemonic is pathogens. That's pretty clear. It is a pathogen that gets into the bloodstream and colonizes the heart valves or endocardial membrane. And so we can use this to remember things like P as for petechiae, A for anorexia. A lot of that anorexia is due to the fact that the spleen becomes enlarged and presses against the stomach. Remember that the spleen is one part of our immune system, and it helps to fight infections. And T is for tired. H is for high fever, or H can also be for heart failure. And then O is for the ocular nodes, the peripheral manifestations. G is for fingernails. E for embolic events. And N is for new murmurs, or N can also mean night sweats. And then S would be for the splenomegaly. So let's review a few questions on infective endocarditis. You can find lots of nice NCLEX questions on this topic. A patient with endocarditis has listed in their medical history Roth spots. You know that that is a complication of infective endocarditis and presents as That's correct. C, retinal hemorrhages with white centers. Here's another multiple choice question. A patient is receiving treatment for infective endocarditis. The patient has a history of intravenous drug use and underwent mitral valve replacement a year ago. The patient is scheduled for a transesophageal echocardiogram tomorrow. On assessment, you find tender red lesions on the patient's hands and feet. You know that this is a common finding in patients with infective endocarditis and is known as C, ocular nodes. Very good. And here we have a select all that apply question. What are the typical signs and symptoms of infective endocarditis? Remember, this question is saying typical. And there are 4 correct answers. If you said hyperthermia, that's correct. Enlarged spleen, C, that's correct. And F and G, heart failure and murmur.